Okay, good morning, everyone. My name is Nas Laban. I'm happy today being a Tuesday. I'm so happy, my viewers and everyone within the country, within the nation, and all over countrywide. Okay, it is a wonderful morning, and I appreciate everyone who is viewing this video. Just support me by subscribing there, sharing, and you just open that bell. I will appreciate so much, so much, so much. Even if it is a new one, and it is a new channel, but I believe everything is possible with God. Because before doing everything, you should start with God. Thank you so much. Okay, without wasting time, without wasting even a single minute, let us look into a major business. Okay, today I'm going to teach you. Okay, before there, this is a room where we collect patients. This is a procedure room, as you can see from the background. Okay, thank you again, and thank you so much. Let us turn to our business for today. For today, we are going to look about this disease called acute rheumatic fever. By show, just a comment section, you can ask what is acute rheumatic fever. We will just go and look a bit of it. Whereby we look at the definition of acute rheumatic fever, the cause, the management, the nursing management. Actually, will go under the nursing management and how we can manage. Okay, let us start with the definition. What is acute rheumatic fever? Well, acute rheumatic fever, it is just the way it is acute. It is called acute autoimmune infection or disease that is caused by a certain organism called Group A beta hemolytic streptococcal throat infections. It is just an infection of the just throat that is caused by the GAPA B beta hemolytic. Okay, that is the explanation of the acute rheumatic fever. Let us go deep into his signs and symptoms, whereby they are being grouped into two. We have the the minor signs and symptoms and the major signs and symptoms. Let us start on the minor ones, whereby seeing these symptoms you can query out maybe it is could be acute rheumatic fever. Okay, as a nurse, as a good nurse who can work abroad, America, USA, Canada, and blah 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 for the good countries, for the whitish countries, you can. It is good to know these. Okay, people. So we have the minor signs and symptoms of acute rheumatic fever, whereby there are the first one is called abdominal pains. In patient presenting with acute rheumatic fever, there is an abdominal pain whereby you feel some pain below the abdomen. Another one is called chills or fevers of around 38.9 degrees Celsius to 40 degrees Celsius. Another one is called arthralgia. Arthralgia. It's also a signs and symptoms of acute rheumatic fever. We have headache, joint pains. We have the sudden onset of the sore throat. Sometimes patient may present with the extension of the jugular veins, whereby they become tenderness. You have the tenderness of the lymph nodes. Those are some of the signs and symptoms of acute rheumatic fever. Okay, let us go into the major signs and symptoms. What are the major signs and symptoms? whereby the patient presents with this automatic, and this is called rheumatic heart fevers. Okay, maybe clinically you can diagnose a patient with acute rheumatic fever majorly using the major signs and symptoms of and go into the lab work. Let us start. Number one is called arthritis. What is arthritis? Arthritis is just the joint pains, several joint pains in the major joints like the elbow, the ankles, and the wrist. That is called arthralgia, whereby in acute rheumatic fever, it happens whereby patient present with pains, pain in major joints like the elbow, the ankle, and wrist, and other joints. That one is called arthritis. Another one is called carditis. What is carditis? Just the inflammation of the pericardium, the myocardium, and the other one. Whereby in the heart, how can you know that this patient is has been is how can you diagnose that this patient amekuwa affected na carditis? How can you diagnose carditis in a patient? In short, we should look at some features. Some features are like this patient will present with new murmurs, whereby you take the stethoscope, just listen, you feel some abnormalities in the heart. Another signs and symptoms of carditis is called on chest X-ray. This patient will present with cardiomegaly. Cardiomegaly is just the enlargement of the heart. That patient will be being diagnosed with acute rheumatic fever. Another signs and symptoms is called subcutaneous nodules. Subcutaneous nodule is just some nodules at the extensor surface of the patient's maybe hands. Some painless nodules that present and may present maybe some 1 to 2 weeks, around some 1 to 2 weeks. Okay, we have the risk factors to acute rheumatic fevers. Number one is called age and sex. What about age and sex? In age, children above 5 to 15 years are likely to present are at the risk of being able to get the disease. And also, it is also risk to women. But we are being told that children below 3 years are excluded of getting it, and women above 40 years. Another second one is called housing and socio-economic status of the patient. Where you live, the socio-economic status of the family, like where you sleep, what you eat, poor hygiene. That one is also a risk factor. Three, the seasons, whereby these microorganisms called the GABA, beta hemolytic throat infection, is commonly found majorly during the rainy seasons. So rainy seasons is also a major. Another one, the fourth one, it is called genetic predispositions, whereby acute rheumatic fever tends to run within the family lineage. Okay, my viewers, thank you so much for listening me. It is just an introduction, but better things are coming. Better health talks are coming more and more in this video. This is just an introduction Try to follow me, share, like, and subscribe. Thank you so much. I just have one subscriber, but I believe everything will be possible. I will reach the maximum subscribers. Thank you so much. God bless you.